A few years ago, I had a dance teacher who started missing a lot of classes. It's because her hips were absolutely killing her. This was a serious problem. Dancing was her business. If she couldn't dance, she couldn't teach, and if she couldn't teach, she had no business. She went to her doctor, who told her that a virus had targeted her hip joints, and she was relieved. Finally, a name, an explanation, something to fight. I offered to help her using the germanische Heilkunde. She looked at me and said, "But what if it isn't true?" I've thought about that question for years because she was asking something that a lot of people wonder. What if the GNM explanation isn't the right one? What if her doctor was right? What if there really was a virus doing this thing to her hip joints? Here's what I've come to. Even if her doctor was 100% correct, I could still have helped her using the GNM, not instead of medicine, but with medicine, because the GNM is not a competing medical theory. It's a completely different kind of understanding. And today I want to talk about what that difference really is and answer a question I get asked a lot. When should you not use the germanische Heilkunde? Nature makes no mistakes, and your symptoms are no exception. Welcome to Mind Over Symptom, where we uncover the deeper pattern. The short answer to the question, when should you not use the germanische Heilkunde, is never. You should never not use the germanische Heilkunde. But that only makes sense once you understand what the GNM actually is and what it isn't. Here's the situation most of us end up in after discovering the 5 biological laws of the Germanic New Medicine. We're convinced it's real. We've had experiences that have confirmed it. We understand, at least in theory, that symptoms arise from conflicts in the psyche. We've maybe even had some profound shifts using that framework. And then something scary happens, like maybe a chest pain or a high fever or a scary test result. Or we try to share the GNM with somebody we love who's suffering, and they look at us exactly the way my dance teacher did and say, "But what if it isn't true?" And we freeze because we don't actually have a winning answer to that. We know the GNM is about natural law, but we also know people die. And the last thing we want is for someone to die because we talked them out of going to the doctor. So we either go too far in one direction, trust your body, never go to the doctor, or we don't go far enough and we hedge every time someone pushes back, which means we're not actually helping anyone. The confusion comes from not having a clear framework for how the GNM and conventional medicine relate to one another. What's the cost of getting this wrong? If we default to always go to the doctor and treat the 5 biological laws as just some helpful extra information, and most of us do revert to that thought process when we're scared, we're reverting to the old paradigm, which is the normal paradigm. And that old paradigm is that if I'm feeling bad, then something external is doing something to me. Since there's an external cause, experts are in charge of fixing it. It's out of my hands. My job is to become a compliant patient. In that persecutor, rescuer, victim scenario, we lose the most valuable thing that the GNM offers, which is not a diagnosis. It's a completely different relationship with our experience. If we go the other way, never go to the doctor, only trust the GNM, we might be leaving ourselves or someone else without help that is genuinely, immediately needed. Both errors, the total abandonment of the 5 biological laws and the total abandonment of mechanistic medicine, have real consequences. Now, it's understandable that we're confused. Medicine itself has muddied the waters because modern medicine constantly blurs the line between illness and injury. It treats chronic illness like an emergency. It creates urgency around things that aren't urgent. It scares people into compliance, which, and this is not a coincidence, creates more illness. So how do we sort this out? There are 2 fundamentally different categories of physical problems. First, there are special biological programs. This is the source of what we call illness. A special biological program is your body's intelligent, purposeful response to a biological conflict in your psyche. It always begins in your psyche, is mediated through your brain, and produces changes in your body that are designed to help you solve the conflict and to evolve. The symptoms that arise this way are not accidents or mistakes of nature. They follow the 5 biological laws, and they have a logic. The second category of physical problems is acute anatomical problems. And these are not psyche responses, although your psyche might be completely freaking out about them. These are biological programs with direct physical and mechanical issues in the body. Injury, poisoning, malnutrition, for example. A broken bone, excessive blood loss, a blocked airway, venom. These are situations where something isn't going well with the body's hardware. Now, special biological programs and biological programs are different situations. And the entire health industry, especially conventional medicine, this is Dr. Hammer's central critique, and I agree with him, is that it treats special biological programs and biological programs as though they're the same thing. It approaches chronic illness with the urgency and interventionism appropriate to trauma. It does surgery on things that we're in the process of resolving. It scares the living daylights out of patients with prognoses that the patients then spin off into new biological conflicts. And the result of all this kind of thing is enormous harm, not because doctors are malicious, but because their framework is wrong. What medicine does brilliantly is mechanical intervention into our bodies that we cannot provide for ourselves. Excessive blood loss, toxicity from venom, substances, or even excessive metabolic products like too much calcium in an active parathyroid program, for example. Extreme hypo or hyperthermia, including dangerously high fevers, blocked airways, blocked gut. These are moments when something mechanical needs to be done in the body and sometimes needs to be done fast. So you want to get allopathic treatment when you're in that kind of trouble. But that doesn't mean you aren't using the 5 biological laws anymore. You still want to understand why your airway is blocked. Is it a lung tumor or did you inhale a ping pong ball? You want to understand that your dangerously high fever is because you resolved a really intense conflict. Understanding that helps you to understand that this isn't a punishment for doing something wrong. It's a restoration process after doing something right. And that helps you to not relapse into that same drama again. Medicine is outstanding at 3 really helpful things. 1, anatomical and mechanical adjustments. Putting a bone back together, removing a blockage, suturing a wound. These are real skills. 2, anesthesia. The ability to render someone temporarily insensible so that painful and freaky mechanical work can happen without the person making gigantic biological conflicts in their psyche about it. That's genuinely extraordinary. That is extremely life-saving. The third thing that medicine is outstanding at is diagnosis. And this is really valuable when done in the right way. The word diagnosis comes from Greek. Dia, meaning split, and gnosis, meaning knowledge. Diagnosis literally means split knowledge. In practice, our best guess. Your doctor's best guess, grounded in years of nosological training, that is, training in comparing your anatomy and behavior to established norms, that's genuinely useful information. Knowing what tissue is involved, knowing the extent of a change or difference, knowing what's happening structurally, that's data you can work with, whatever framework you're bringing it to. But in the GNM, it's especially important because it tells you which tissue you're working with and which germ layer. Now you know what kind of biological conflict you're dealing with, whether it's an active conflict or in a healing phase. You can plan for what's coming as you move through the healing phase, and you can focus on what you need to become to complete the special biological program and evolve. Where the should I use GNM or not question gets tricky is when it comes to stuff going on in our body that isn't acutely dangerous. What about things that could become dangerous if left unaddressed? Should we mechanically intervene here? Protein or electrolyte depletion over time, a digestive tract that's partially blocked or moving slowly. blood sugar that keeps oscillating a bit higher and then a bit lower than the normal range. Insomnia that drags on for weeks, so you're a zombie at work or in your commute. Anxiety, self-hating thoughts, rage. These aren't anatomical emergencies, but what if they get worse and become emergencies? So this is actually the exact point where conventional medicine and Germanic New Medicine are at total war with each other. Conventional medicine says, catch it early because it is going to get worse, because you are a mechanical system that is subject to entropy and things are always going to get shittier if you don't intervene in your body, and if you don't intervene early, you're basically asking for a horrible experience and a short life. Germanic New Medicine says you are evolving, you are always new, and things are always getting better because every special biological program is meaningful in the context of your evolution. Stop interfering in your body and panicking in your psyche because you think you're on the verge of destruction, and stop telling other people that their bodies are hunks of junk too. Now, each of these points of view sees the other one as criminally dangerous. And knowing that, you might think I'm about to say that we have to pick a side, right? Either reject the monsters in the white coats or reject the hammer death sect, right? Well, no, because you can't reject either the Germanische Heilkunde or the allopathic mechanistic model. They're both important. Now, I'm a GNM person for sure, but just because the health industry is full of misguided people who are totally motivated by soulless profit and medieval models of reality doesn't mean I don't value heart-lung bypass machines and the ability to save someone's life when they get hit by a bus. This is amazing knowledge, and I feel endless gratitude that it exists. What a time to be alive. But I also know that the 5 biological laws are always at work, and it's always valuable to know and study them. Understanding what conflict is driving a symptom, what phase you're in, what the biological purpose is, that's always relevant. You don't put down the Germanische Heilkunde just because you've also got sunstroke and need electrolytes. There's another problem when we reject mechanistic or allopathic medicine, Schulmedizin, as Dr. Hammer called it. Candace Pert was a neuroscientist and pharmacologist who spent her career studying neuropeptides, the biochemical carriers of emotion. She showed how, in cell mitosis, daughter cells inherit the emotional content of their precursor parent cell. This is very helpful in understanding why unborn babies can develop similar biological conflicts to what their parents tend to. It's because the sperm and the egg inherited some of their parents' emotional content, and the child's developing system then inherited the emotional content of the zygote, the fertilized egg. But more important than this discussion, Candace Pert's research showed that we can literally get in the habit of our biological conflicts. Our special biological programs are the devil we know, and that makes it hard to evolve, move on from them, and let go of them. In those situations, a sharp outside intervention can really break the loop. It's the principle of hormesis, or hormetic therapy. It's a stressor that resets the system. It's actually the job of the epicrisis in every special biological program, but we can do this on a meta level. Jumping into cold water when you're depressed, or sometimes a conventional medical intervention that interrupts the habitual pattern long enough for something new to become possible. This is one of the underappreciated mechanisms of conventional medicine when used wisely, not as a cure, but as a pattern interrupt. So it doesn't matter if you're a practitioner, your doctor or naturopath or chiropractor or whatever specialist you're talking about. It doesn't matter if that person believes that what's wrong with you is from a physical imbalance or a deteriorating mechanical system. Sometimes their physical intervention is just the ticket to help us get better because they interrupt the pattern in our psyche, brain, and body. A little wake-up call, or showing us what it could be like if we would get past this. But we're still using the Germanische Heilkunde when we do this. We're still being objective about our own biology and making decisions based on an understanding of the meaning behind what is happening in our biology. I want to address what using GNM or using Germanische Heilkunde really means, because There's a lot of confusion about this when people discover the 5 biological laws and want to know how to actually get better using them. Like, what's the actual therapy here? Using the Germanische Heilkunde is not about finding the DHS. It's not about changing your perspective. It's not about making sure the trauma can never happen again, which is, by the way, impossible. The goal of this work is not to make you trauma-proof. It's not about avoiding tracks. It's not even about feeling the feelings. Using the GNM means taking the 50,000-foot view, looking at what's actually happening in your experience, in your psyche, in your relationships, in your life, with honesty and without turning away in a panic and seeking a rescuer because you don't like what you're seeing. It means taking responsibility for your experience, not blame, responsibility, acknowledging that you are the author of your biology. You are not the victim of it. That's the opposite of the rescuer dynamic, which says something outside you is hurting you and something outside you needs to fix it. To the extent that you're in that victim mode, you're going to worry about whether to use GNM or conventional medicine, because GNM won't rescue you, but conventional medicine will promise to. Now, conventional and most alternative medicine won't actually rescue you, but it'll praise you for asking, so there's that. If you make the choice to not be a victim at all, to instead seize control over your experience and transcend that paradigm, I mean, admit that you want to be rescued, and then knuckle down and start doing the real work, which is taking charge of your own psyche. Once you do that, you transcend the whole problem of, should I use this or should I do that? Now you've got real power because you can use the 5 biological laws of the Germanische Heilkunde and you can go get some work done by the allopath. You can be healthy and happy because you're evolving and completing your special biological programs, and you can go get surgery and antibiotics to help you with a healing phase symptom. You can hold the GNM framework while going to the doctor for an X-ray. The two systems are not mutually exclusive. So, when should you not use the GNM? Well, it was a trick question. You should always use the GNM because the GNM is not medical theory competing with other medical theories. It's a framework for understanding your own experience. You can use that framework while getting stitches, while taking a prescription, while your doctor's explaining your test results. The 5 biological laws don't tell you whether to go to the hospital. They help you understand what's happening in your psyche before, during, and after whatever you decide about going to the hospital. My dance teacher asked, but what if it isn't true? What she was really asking was, what if I look at my own experience honestly and it isn't enough and I don't get better? And you know, it was both her hips involved. As a GNM practitioner, I knew 3 things. 1, the issue had to do with finally pushing forward on something that she had really wanted to do for quite some time, or really wanted to do quite intensely, and maybe didn't really believe that she could, but then she did it. And she was in a healing phase of that. 2, I knew the issue involved both her husband and her daughters. This caused involvement of both hips. 3, she was therefore megalomaniacal in regards to the conflict content. This woman was going to delusionally underestimate what it would take for her to push forward in ways that she really wanted to, until she had completely resolved and completed the healing phases of both self-devaluation conflicts. So knowing these 3 things, her having a nice, easy answer that she could tell her dance class, oh yeah, my doctor realized that a virus attacked my hips. That was actually kind of a nice way for her to move forward with her dance class and continue moving forward in her business despite a lot of relapsing self-devaluation about whether she should or not. Allopathy provided her with a convenient lie that GNM would never have given her. To her original question for me, but what if GNM isn't true? And to her real question, which was, what if I look at my own experience honestly and it isn't enough and I don't get better? The answer is, looking at your experience honestly never hurts. The GNM can coexist with every approach to health. It just can't coexist with the victim role. And alas, most of what we call the health industry is built on the victim role. But we are in a time of monumental cultural and civilizational change. I believe that in 100 years, the health industry will be using the Germanische Heilkunde, or there won't be a health industry. This has been Mind Over Symptom with Lishui Springford, where symptoms are not the enemy and you are your own authority. For more, visit mindtreehealth.co.